I wanted to start off though tonight by just talking about our friends and family in Melbourne. It's just hard to know what on earth we can do for them suffering in the capital of Victoria at the moment. They're still in lockdown, 5 million of them, in a lockdown that never should have been called and which is now demonstrably unnecessary. If you wanted to believe it might have been necessary previously, surely you can no longer argue that that's the case. In the past 24 hours, another 49,000 tests have been conducted across Victoria and just 4 infections have been revealed, all close contacts, therefore all already isolated under normal circumstances of managing an outbreak. Therefore, the lockdown was pointless. It did nothing to either locate these cases or confine them. The lockdown is again, like the last one, superfluous. All pain and no gain. But I'm afraid it gets even worse than that. After spooking people, frightening them, telling them about a beast of a virus, that you could catch it just by brushing past someone, and that if there was no lockdown, someone would die, people would die. Well, it turns out the 2 cases of high concern were not COVID cases at all. False positives. Nothing to worry about. As you were, you'd think, move on. But no, it doesn't work that way in Victoria. Don't expect the Victorian authorities to calm down or ease up.
That's all reassuring. That said, we've got disturbing news overnight and we just need to take every single day as it comes.
Yeah, there's always disturbing news. There's always a way to find you, to give you a new twist. They're looking for a new angle, new rhetoric, new twists to ratchet up the fear and the paranoia.
Variant is the Delta variant, is now infamous in India. It is a variant of significant concern.
How many times have we heard all that? And the media, well, far too many of them, they just love this game too, especially those from the public broadcasters, no threats to their jobs by lockdowns and the like. They love to crank up the fear, tabloid style, at every turn.
How worried were you when you heard the sequencing overnight? It's a variant not linked to anything seen before. That makes me worry. Should people worry?
We just have to do what we have to do. It's new information. It's an unrelated cluster, and it's a variant of significant concern.
This stuff is just terrible, this desperate search every day to find the new angle, the new twist that's going to maintain our levels of fear. Now, to get ready for this pandemic last year, we quickly and dramatically and very efficiently tripled the number of critical care beds available in this country from just over 2,000 to more than 7,000. So we were ready in case we didn't flatten the curve. And you know how many of those beds are being used right now? How many COVID-19 patients are in intensive care beds in this country? More than 7,000 beds? Not one patient. None. And there have been no deaths in Australia from local infections in nearly 6 months. And as far as we can tell, no one is seriously ill in Victoria. But the whole state has been locked down, and Melbourne remains in lockdown, and politicians and journalists spend all day trying to frighten people. Perhaps a few more people should hear a little more from our National Chief Medical Officer.
In fact, most of the people that have been picked up in Melbourne have been asymptomatic or mildly ill, so that's good news.
Good news, all right. No one is sick. Who would want to share that, hey? Who in the media would want to share news like that? Why let a fact like that get in the way of lockdowns and hysteria? I'll tell you why. Because without creating fear, Victoria's incompetence would be exposed. Without finding a new phrase, a new term, a new way to frame a variant, a new way to describe transmission, Victorian officials and the acting Premier James Merlino would be left to explain their actions. Why they lock down when all the cases are close contacts. Why they lock down when no one is getting sick and our unused health capacity is almost limitless. Why they lock down when the vulnerable, the elderly, the only people at serious risk from this disease are already vaccinated. Why they lock down when they know New South Wales has handled this and worse many times without locking down. Yet these people are frightening Victorians and frightening the rest of the country for that matter in order to hide their own incompetence.